The rotator cuff is the deep layer of muscles in the shoulder that provides stability for the glenohumeral joint, or the ball and socket of the shoulder. So it's incredibly important for function of the shoulder. To diagnose a rotator cuff tear, we start with a physical exam and a history on the individual to see what their symptoms are. And then commonly we need radiographs to look at the bones of the shoulder, and an MRI will show us the soft tissues, the muscles and tendons like the rotator cuff, to see if there is a structural problem or just inflammatory changes. When a patient has a rotator cuff tear that requires repair, we repair the rotator cuff arthroscopically with sutures and anchors that we can place into the bone and sew the tendon back down to the bone to repair the defect in the tendon so that it can heal. Not all rotator cuff tears require surgery. Many times we try to treat partial thickness rotator cuff tears conservatively, and those can do fine with steroid injections, physical therapy, and avoid surgical management. When I repair a rotator cuff tear surgically, I most commonly will use the tendon seam device, where we place an array of anchors on a repair suture through the tendon into bone and create a construct that provides more strength and stability and compression across the rotator cuff tendon in the zone of the repair than traditional transosseous equivalent type repair techniques. Patients that have a rotator cuff tear that needs repair sometimes need a collagen graft to augment that repair if there's a deficiency in the tendon or poor tendon quality, or in partial tears, we can use a collagen graft as the repair to help fill in that partial defect. Platelet-rich plasma, or PRP, is an option many patients want to do at the time of surgery, which has data in the literature that supports that it may help improve the success rate for the repair to heal after a rotator cuff repair, and also may have some improvements with patient outcomes with physical therapy and postoperative pain. Recovery after a rotator cuff repair starts with physical therapy, typically the next day after surgery. And patients go through a process of range of motion and then strengthening and function recovery that takes 3 to 4 months to return to full, unrestricted activities. I'm Howard Harris, a board-certified, fellowship-trained shoulder specialist, and I'm currently accepting new patients at our Bedford office.